Well, now on AM Extra, back in August, Multnomah County reported a 533% increase in overdose deaths from synthetic opioids between 2018 and 2022. Experts say the key driver behind those overdoses is the availability of fentanyl.
And for many of those trapped in the throes of addiction, it can feel like recovery is impossible. However, recovery is possible, and there are resources available right now to help. Here to tell us more about addiction recovery and treatment is Tim Murphy. He's the CEO of Bridgeway Recovery, a healthcare organization that provides medical treatment and therapy for those struggling with addiction. He joined us live this morning. Good morning. Thanks for being with us.
Thank you. Thanks for the invitation. And I really appreciate the focus on treatment and recovery. That's a really important thing. And as just stated, the fentanyl crisis is facing Oregon. It's facing the United States. Actually, it's a huge crisis. I've been in this work for over 30 years in Oregon. This is the biggest crisis we've had with addiction and with overdose, and we're seeing a spike around the nation. It's not just Oregon. It's not just Portland, and we collectively as a country have to do something about it.
What's driving this, in your opinion?
Well, there's a variety of things. One is the influx of, so the thing to understand is fentanyl is a widely used medicine in pain management in post-surgery. The fentanyl crisis that we're experiencing is not legal fentanyl. It is illegal fentanyl that's being produced. The route seems to be China to Mexico to the United States. And it's been around for quite a while. We've had a crisis in the eastern part of our country with fentanyl 5, 6, 7 years ago. It's slowly come out west in the last 3, 4 years, and it's pretty predominant. It's really inexpensive. It is extremely powerful, and people have a really hard time stopping the use of fentanyl. So some of our traditional treatment methods for addiction haven't been as effective with fentanyl.
Well, let's talk about Bridgeway. What is Bridgeway? How did this concept of Bridgeway begin? What kind of services does Bridgeway provide to help here?
Sure. Thanks for asking. I really appreciate that. So I started Bridgeway. I was the founder, started Bridgeway Recovery Services in 2009. It is a multimodal, both mental health and chemical dependency treatment program. We have a full range of outpatient and medically managed withdrawal detox, residential treatment for substance use disorder. We have a primary care component. We've got counselors in all the schools, middle school and high school, and the Salem-Keizer School District. We're really doing a pretty strong outreach to the community and trying to build resilience and with kids, refusal skills, and for adults that are struggling with symptoms of addiction. We know that people can recover from addiction. We know that we can treat this, and we see it every day. So we're focused around developing, there's a great shot of one of my residential programs. We're focused on developing access and building opportunities for people to reach treatment and be successful.
Yeah, we only have about 30 seconds here, so I know we need more than that to talk about this topic. But Measure 110, it decriminalized drug use, and it was supposed to use funds for treatment centers. What's your opinion of 110 and whether it should be repealed?
I expected that question, so it's nice that you asked. So it's important to remember Measure 110 had two components. One was the decriminalization, not legalization, but decriminalization of certain drugs. The other component was the redirection of the taxes raised on sale of recreational marijuana. That money was, as a result of Measure 110, is being directed into treatment programs all around the state. Over $200 million has been distributed only about a year ago to treatment programs like Bridgeway up in the Portland area, Southern Oregon, Eastern Oregon, and there's a robust amount of work being done right now as a result of that redirection of money. And we're a year in, We already are seeing incredible improvements in access to treatment and additional treatment opportunities for people.
So it sounds as if you're in favor of keeping 110 and increasing those treatment services. Tim Murphy, CEO of Bridgeway Recovery, we appreciate you joining us.
Thank you. Thanks, gentlemen. Appreciate it. Nice seeing you.
Take care.
And to learn more about Bridgeway Recovery and how it can help, go to the link on our website at coin.com.
All right, another headlines now.